world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Ayesha Sitam is a well-known dermatologist and has been practicing medicine for over many years now. She is MBBS, MD and specializes in dermatology, cosmetology and trichology. Currently, she's practicing as dermatology at Hitech Medical College, Bhubaneswar. Dr. Ayesha has dedicated her career to diagnosing and treating a wide range of hair and skin condition while providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets the individual requirement. Dr. Ayesha is also aware of the need for the patient awareness and education about hair care, hence spend a lot of time in giving talks at various platforms across the country. Thank you, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live.
Thank you.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत
I think there
शुक्रिया.
is some light issues. Yeah. Give me some. Okay. Yeah.
Yeah. So, doctor, today we are going to talk about hair care in current scenario. And whenever we talk about hair care in current scenario, the first and the foremost question is the hair loss, and it is something like very common faced by all of us, irrespective of gender and age. And there is very confusion between what is hair loss and hair loss. So, can you please enlighten hair fall and hair loss? So, can you please enlighten us like what is hair fall and a difference between hair loss and is what's normal and when to be concerned for?
Okay. So, hair fall nowadays, everyone is concerned. Like it has become a part of beauty, and everyone wants like they need good, thick, long hairs. So,
Mhm.
hair fall is normal. Let me say because the hair undergoes a cycle of growth and then gradual resting phase and then a catagen phase. So as the hair grows, so there is some amount of hair fall which is very normal. When
Mhm.
there is more than 100 hair per day, when the hair fall is more than 100 per day, so in those conditions we say that the hair fall is abnormal. And
Mhm.
also if there is a pattern kind of hair loss, like if the central parting is visible and the density of hair is very less and there is
Mhm.
split ends present in the hair, plus if there is patchy hair loss associated
Mhm.
with autoimmune conditions,
Mhm.
or if there is psychiatric conditions like trichotillomania, and
Mhm.
if there is hair loss due to various chemotherapies and nutritional deficiencies, in those conditions we might find more than 100 hair fall per day. In those conditions it is a problem.
Okay.
The patient should approach to a trichologist in those conditions.
Okay, so when the hair fall is like more than 100, it is time like don't
Per day,
we
yeah.
yeah, and we should visit to the doctor. Okay, very
Yeah.
interesting, doctor. So, doctor, like when there is a hair loss and no other treatment is suitable or not working, then the only option left is hair transplant, and people are very quite like confused like what is hair transplant, is it like a very big surgery or what is this, so and they get scared also. So can you please enlighten us like what is this, what is hair transplant?
Yes, you rightly said that we don't go for hair transplant as a first reservoir. It is generally taken as a last reservoir. And in
Mhm.
some conditions, it's also contraindicated. So it depends on a doctor whether the condition is apt for going for a hair transplant or not. So
Mhm.
first we go for minoxidil, finasteride, and other oral medications, and associated conditions we rule out. What is the exact cause of this hair loss is very important. And
Mhm.
after that, we also go for PRP, that is platelet-rich plasma. If nothing is working and also the hair loss is not related to other chronic conditions or
Mhm.
any other nutritional deficiencies, so in
Mhm.
those conditions, we mostly go for a hair transplant. It is a surgical procedure basically. In that, what we do from the donor side,
Mm-hmm.
we transplant some hair follicles into the recipient site of the person. Mostly the donor site is on the back and also both sides of the scalp.
Mm-hmm.
So, it is a safe procedure, but it is preferred as a last resort.
Okay, okay. So, doctor, like, are there any complication of like after hair transplant? Is there any complications? Like, yeah, you said it is safe, but is there any complications which people can face during hair transplant or post hair transplant?
Okay, as I said, it's a safe procedure. Since it is a surgery, every surgery has its own pros and cons.
Mm-hmm.
So, surgical complications may be present, like it should be done by a proper trichologist who has done a lot of hair transplant. It should not be done by random doctors. So
Mm-hmm.
that will help to decrease the complications. There may be mild bleeding, edema may be present, which is reversible. It gradually reverses. And also
Mm-hmm.
infection may be present. If a proper follow-up is done on time and the patient is taking care of the hair, so these things can be reduced. So risk like hematoma may be present, and also from the donor side, patchy hair loss will be present, which is transient. It is reversible. So it is
Okay.
very safe if any surgical complications is not present, and proper pre-surgical workup and post-surgical follow-up if it is done properly. So it is not a very complicated procedure or having a lot of risk. Normal surgical risk is present. So that should be avoided before going for a hair transplant.
Okay, so it's quite safe and very few
Yes,
complications are there, which are very easily manageable by the doctor if you get it
yes,
done with the expert doctor. Okay,
yes.
quite interesting, doctor. So, doctor, like there are so many doctor MBBS and dermatologist and physician, and there are so many information everywhere that this doctor can give you 100% hair pack. So, whom should we refer and when to refer for hair transplant?
Okay, so if there is more than 100 hair fall, so per day, so patient can approach a doctor, and
Mhm,
first the doctor should evaluate what is the exact cause of the hair fall.
mhm,
If the cause of the hair fall is other causes, so that should be treated first. If there is anemia or hypothyroidism, other causes, or any nutritional deficiency, that should be treated. Patient should be started with minoxidil. If nothing is working, then only
mhm,
we go for hair transplant.
mhm,
So, choosing a right doctor is also important. The one who is very experienced and also done a lot of surgery, and the doctor should be able to show photographs of improvement of the patient, like
mhm,
from the before and after pictures. The
mhm,
doctor should be able to evaluate what exactly is the condition of the status of the patient, why the patient is suffering from hair loss, whether it is appropriate for the patient to undergo for a hair transplant or not, and
mhm,
also aseptic measures should be present over
mhm,
the clinic, and so that infections and everything can be avoided, and an
yeah.
experienced doctor will always help. So
Oh,
opt for an experienced doctor whenever you go for a hair transplant.
okay, so while looking for an experienced doctor, what certification which we should check as a patient for for our hair care? Because for normal thing, common cold or any other stuff, we know like for diabetes we'll go to endocrinologist, but people don't know for hair health or for hair care or skin care which doctor we should visit.
We mostly go for a certified doctors, like American board certification should be present, and the doctor should be experienced enough to do the proper type of surgery, from where the donor site should be chosen, and what kind of incision should be given, and also to what extent, what depth of the tissue should be taken. These things should be taken care of.
Okay. Okay, so doctor, like so many hairs are getting transplant while this procedure. So does this procedure hurts?
Okay, since it is done under a local anesthetic, also regional nerve block is also done. So as
Mhm,
of during the procedure, it will not hurt, but post procedure there might be a bit of edema, which
mhm,
might create little problem to the patient. But if proper precautions are taken, like 15-degree to 30-degree elevation can be done in the patient. So in those conditions, things becomes better. So there will be no associated pain or infection if it can be prevented post procedure. Those things might cause a little bit of pain and itching and irritation, but if
Mhm.
those are taken care, then it is very safe.
Okay, so it's safe and a bit of pain is there, but it is manageable pain. So, doctor, we have already talked about it. Like there are so many information, and people are like in saloon also. People are saying that we'll do your hair transplant at a very minimum cost. You don't need to go to the doctor for the hair transplant. So, what is the cost of hair transplant in India, and what are the reliable sources where we should get it done?
Okay. So the cost depends on the location where you are undergoing a transplant, like which part of India you are going to transplant, and
Mhm.
also what extent of hair loss has happened, how much hair follicles are to be transplanted. Depending on that, it depends. It may range to 50 to 100 rupees per hair follicle. So around 24,000 to 2 lakhs. It can range up to that. But
Mhm.
it is quite safe, so patient may prefer. It is done in very limited institutes and should be done by certified doctors only.
Okay. Okay. So, doctor, while choosing the hospital or a clinic, what things a patient should take care of, like while choosing any particular hospital or clinic for hair transplant?
Okay. So, while choosing clinic, as I said, the doctor should be certified and also the safety precautions should be present, like asepsis should be maintained and the pre and post care should be done. The patient should come for a follow-up for stitch removal after 7 days, and all the advice should be followed. In case of any kind of complications, the patient should be always approachable. The doctor should be approachable, and
Mm-hmm.
all the follow-up should be done on time. In those conditions, a better clinic, who has done a lot of transplant can be preferred.
Okay, okay. An experienced doctor with certification and proper cleanly
Yeah.
hospital, yeah, outlet can help. Okay, quite interesting,
Yes.
doctor. So, doctor, another very common people get scared of getting a hair transplant, thinking that too much of care will be needed to be taken care after hair transplant. So, can you please enlighten us with your profound experience, like what care to be taken after hair transplant by the patient, and is there any requirement taking those care to manage the hair after hair transplant?
Yes, smoking and alcohol, first of all, these things should be avoided. And there
Mhm.
might be mild edema. So, in those conditions, patients should try to sleep in 15 to 30-degree raised position. Direct shower head over the shower, putting pressure over the hair should be
Mhm.
avoided. The patient should wash their hair for almost 3 days with normal saline, and after that with a mild shampoo. The patient can go for that.
Mhm.
The patient should use minoxidil also along post transplant after 7 days. And also, patient should avoid direct exposure to sunlight and cover the hair mostly.
Mhm.
That should be
Mhm.
done.
Okay. Okay, so minimum amount of care is required, which is like normal follow up and medicines which are given by the doctor, and taking protecting the hair from sun, and just minimum kind of care, and the hair health will be fine. Okay. So, doctor, now my favorite part. Can you please give us some important tips for healthy hair?
So, healthy hair is the very important thing for looks of the patient.
Mm-hmm.
First of all, stress. We should avoid taking a lot of stress because that also causes a lot of hair loss. And also, we should try to eat a balanced diet, having vitamin A, D, E, and also biotin. All these things should be present in your diet. Remaining hydrated and doing regular exercise is very important. Direct exposure to pollution and sunlight also that should be avoided. And patients should avoid more of hair styling and using chemicals which damage the hair frequently. So
Mm-hmm.
these should be avoided. And also, if there is hair loss, instead of using all those regular things over the market which is available and damaging it more, it's better to always go for to consult a doctor before
Doctor.
going for all these home remedies and damaging the hair a lot.
Yeah.
So that will give a healthy and shiny and lustrous hair.
Yeah, yeah. So instead of wasting money on all those products, we should visit the doctor and save our money and get the right solution at minimum amount and save our time also. So, doctor, this discussion was very informative. I'm sure our viewers have found the session very helpful. So, can we take some live audience question?
Yes.
Doctor, in rainy season, my hair fall has increased. What kind of precaution I can take in this season?
So first you have to see whether there was any late history of any disease like
Mm-hmm.
dengue or any chronic diseases associated. Blood test should be done, like CBC and thyroid can also be done. If it is happening only in rainy season, then using a proper hat should be avoid using more of exposure to water, and
Mm-hmm.
that should be done. Plus, over shampooing should be avoided, and using other chemicals also should be avoided. And try to keep the hair as much dry as possible and remain hydrated. The basic things have to be done because it is not associated with disease if it is
Mm-hmm.
happening only in rainy season.
Okay. Okay, quite interesting, doctor. Another question from our viewer is, hi, doctor. I visit to a doctor because I was facing a lot of hair fall, and the doctor told me that I'm having telogen effluvium, and he gave me a lot of medicine, but I still have a hair fall. Doctor, can you please tell me what is telogen effluvium and will it be stopped someday?
Okay. So telogen effluvium is mostly it is an externally induced condition in which there is a lot of hair loss. So there may be associated stress associated or any disease associated with it, or there may be medications which is causing it, which the patient might have taken lately, or any chronic disease which has caused it, or exposure to any hair styling and all these things, or any PCOS, all these things will cause hair loss, but it can be reversible if nutritional deficiency will be present. All these things has to be ruled out first. So better to visit a dermatologist and first get a complete blood checkup before
Uh-huh.
starting any medications. If associated conditions are present, in spite
Mhm.
of giving medications externally, it is very important to maintain the health of the person. If there is anemia, all these things should be corrected prior
Mhm.
to taking all the medications.
Okay, so this telogen effluvium can be controlled, but it's
Yes,
always get our all kind of testing done and then we can
exactly.
fix it. Okay.
Yes.
Quite interesting. Another question from our doctor is from our viewer is, hi doctor, thank you so much for being there for helping us. My question is that I have androgenic alopecia and I've been taking vitamin minerals and I've been doing most of the session of PRP, but my hair is not coming. Is there any solution? And I'm also from Bhubaneswar. How to take your appointment?
Okay, so if, androgenetic alopecia, if it is a diagnosed case of androgenetic alopecia, so how much amount of hair loss it has caused, that is important. Like we have a staging.
Mhm.
According to that, we start our treatment. We give a PRP along with minoxidil. If that is not working, we
Mhm.
can go for a hair transplant, but we have to first judge that how much amount of hair loss has occurred. Like 50%, more than 50% has occurred, and it is disfiguring the patient's day-to-day life and causing hampering that. So we can go for a hair transplant, but prior to that, if PRP is not working along with minoxidil, we can also go for oral minoxidil.
Okay, and he also want to take an appointment, so for that he can Google you.
Yes.
Yeah. Okay. Okay, another question from our viewer is, hi doctor, my daughter is 12 years old and she has a lot of gray hair at such a young age. What's the problem and what is the treatment?
Okay, premature graying of the hair that has various causes.
Mm-hmm.
So in those, we can give treatment, but to reduce further occurring of the hair. But the ones which have already caused graying, those can be reversed.
Okay.
The ones not to occur, you have to approach to a doctor.
Mm-hmm.
And by online video, it is difficult to give the exact advice. But decrease stress and eating healthy will help.
Okay, okay. So even at a young age, the gray hair problems can come.
Yeah, that is normal. That is what we say premature graying of the hair.
Okay, okay. It is normal and it can be controlled with the treatment and other stuff. Okay, quite interesting, doctor. Another question from our viewer is, hi, doctor. 2 years back, I met an accident of fire, and due to that, I got a scar on my scalp, and I want to get my hair back. I did a lot of treatment, but hair is not coming back. Is there any option to get my hair back?
If scar is developed, it has damaged the hair follicle, then it is difficult to grow hair over there by topical application of any uh,
Mm-hmm.
solution or any oral medication. The hair has been damaged. We can go for transplant, but we have to first see how much amount of damage it has caused. But it is not expecting 100% that hair will grow. It's difficult.
It's difficult. Okay. Okay. So he can go for those patches, I think so. I don't know.
Yes.
Yeah.
Yeah.
Okay.
We can camouflage the hair. The
Yeah.
amount of hair destruction first we have to see. We can go also go for camouflaging the hair.
Mm. Okay. For that also he should visit to the doctor. And yeah. Yeah. Okay. Another question from a viewer is, hi doctor. I am at my menopausal age, and my neighbor told me that hormone therapy can control my hair fall because it was controlled by her also. So, is it true that hormone therapy can control hair fall at menopause?
See, hormone plays a very important role for hair fall. So
Mm-hmm.
it depends that the cause of hair fall is not always individual to individual. It is very different. So
Mm-hmm.
it might not be the cause in her. A proper history is very important prior to suggesting any medications or advising it is just for hormone.
Mm-hmm.
Postmenopausal hair loss can occur.
Okay. And it can be controlled with the treatment.
Yes.
Okay. Okay. Okay, I quickly take the last question, and even I want to know, doctor, how is your hair so much straight? Is it natural? I also want a straight hair. Can I go for this keratin treatment, which is very uh, common nowadays?
Okay. So as I've already mentioned,
Hmm.
for a healthy hair, we should try to avoid using chemicals and all those straightening and uh, heat producing some therapies that
Hmm.
will give a good look, but ultimately it will damage the layers of the hair. And
Hmm.
gradually there will be splitting of the hair, and the strength of the hair is lost.
Hmm.
So try avoiding that.
Hmm.
It's better to avoid.
It's better to avoid.
Natural hair are the best.
And I think your genetics are very good. That is, just your hair are very beautiful. This is what the viewer is asking. Yeah. So, fine, doctor. Would you like to give any take-home message or any other suggestion to our viewers today?
Yes, it's very important to take care of your hair because hair plays a very important role both psychologically and also in our day-to-day activity. It also protects us scalp from a lot of things like sun
Mm-hmm.
damage and everything. So avoid damaging it by external injury and eat healthy foods with balanced diet and remain hydrated.
Mm-hmm.
That will solve all the problems, and also have a good hair hygiene. At
Mhm.
least twice daily, you should shampoo your hair. Trimming of the hair should be done.
Mhm.
Avoid any parasite infections in the hair. All these things should be taken care
Mhm.
so that you get a good hair like me.
Mhm. Okay, so even parasite infection can be there in the hair.
Yes, pediculosis capitis and all these infections can happen. So, in those conditions also, patients should not start applying their own chemicals and damaging the hair further.
Mhm.
You should always consult a doctor before putting anything over the hair. That will cause more damage.
Okay, so instead of becoming their own doctor, it's better to visit the doctor and get the prescription and take care of the hair and also for the skin and other stuff. Thank you so much, doctor, for sharing so much of expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful and they have must have enjoyed the show. It was delight to have you and thank you so much, doctor, for your valuable time.
Thank you.
Thank you, ladies and gentlemen, for joining us today. We'll come with a new topic with our doctor on hair or skincare again. And see you again, doctor. Thank you so much. Let's sign off for today and have a nice evening. Bye bye, doctor.